Hello, good evening, everybody. Thank you so much for being here. I see some very full individuals. You all look happy, so hopefully you enjoyed the food to kick off this wonderful presentation that we're going to experience tonight. So if I don't know you already, my name is Stephanie Soriani. I'm the Executive Director here at Cancer Bridges. And if you're not familiar with the work that we do here in the building as well as online and out in the community, we provide free programs and resources as well as education to anybody that has been impacted by cancer. So whether diagnosed, a friend, a family member, a caretaker, someone who is bereaved due to the loss of someone from cancer, as well as in survivorship, we have programming to meet whatever emotional, social, and physical wellness needs they may have. So we offer about 200 free programs and services every month. Like I said, we do them here in the building, so no official tour today, but I'll give you an idea. We have a beautiful health and wellness studio here up above where we do our physical wellness. We have individual counseling rooms, support group rooms, an art studio, a full kitchen where we do nutrition and lots of cooking workshops. And so everything that we do is to bring people together and help you connect with others that might be experiencing something that you are, whether that's through laughter or through the emotional needs through a support group, etc. So I can go on and on about this work all night because there is so much to tell about it. So please, visit our website and learn more. But we're so happy to open our facility here to this group this evening. We're so happy to be a partner for this presentation with Sunspot and GAF. So welcome, enjoy the evening, and I will hand it over to Danny.
Thank you.
You're welcome.
This is for Dr. Cisneros. Hi, everybody. Ooh, it's so great to be back at Cancer Bridges. I haven't been here in a few years. It's nice to be with all of you, so thank you for coming out tonight. My name is Danny Wilson. I'm the Executive Director of the Cancer and Environment Network of Southwest Pennsylvania. And we are a group of about 60 organizations, including Cancer Bridges and the Group Against Smog and Pollution. And together, we are committed to eliminating the chemicals, the toxics that contribute to cancer. So our network is organized into 4 teams. We have science, healing, justice, government action, and collective action. And every team is vital to our shared mission, which is providing scientific knowledge and collaborative tools needed for people to take action against environmental cancer risks and advance health equity. And tonight is an example of our mission in action with these partnerships we have. And so I'm going to welcome Patrick Campbell, and he can take it from here.
Well, thank you, Danny. I'm Patrick Campbell. I'm the Executive Director of the Group Against Smog and Pollution. GASP is an organization that was founded in 1969, and ever since then has been working to improve air quality in southwestern Pennsylvania through education, through partnerships, through legal action, through all of those kinds of activities that involve community and help make this a better place for all of us to live and breathe. I'm so grateful that you're all here. I'm incredibly grateful for Cancer Bridges and the Cancer and Environment Network of Southwestern PA for being partners in this project with us. I'm especially thankful for Laura Kuster, our staff person at GASP, who really played the linchpin of pulling a lot of us together, the chief cat herder, I think. So thank you. And I'm incredibly grateful to our moderator, Dr. Patty DeMarco, and all of our panelists who will be introduced shortly. But to set the stage a little bit, before we get much further, I think all of us are here because we understand, or at least suspect, that air pollution makes us sick. Air pollution is not good for our bodies in any way. There's no daily recommendation of breathing in pollution. So it's not your imagination that air pollution makes us sick. In fact, researchers from Boise State University and the University of Massachusetts published a study in 2021 that analyzed cancer rates alongside smoking rates for every county in Pennsylvania. And what they found was whenever they created a model where they imagined a world where nobody in Pennsylvania smoked. That's a good world. Let's move towards that world. But they imagined a world where no one smoked. And some counties, rural counties, saw cancer rates plummet by 80%. astounding. In Allegheny County, our cancer rates only dropped by 11%. Astounding. That tells us something is going on between smoking cessation, which is behavioral, compared to what are we being exposed to in our environment, that no matter how good our behavior or bad our behavior is, we're exposed to it. So here in Allegheny County, that means we are exposed to air pollution every time we open our eyes, right? Or every time we leave our homes, and sometimes within our homes. So we're exposed to mobile sources of air pollution. Think trains, planes, automobiles. But here in the county, we're also exposed to an incredible amount of industrial air pollution. So major industrial facilities, of which Allegheny County has 29 in this county alone, not to mention those in surrounding counties, these large sources of air pollution can emit up to 100 tons of any air pollutant annually. Or they can emit 10 tons of a single hazardous air pollutant annually. Or they can emit 25 tons of any combination of hazardous air pollutants annually. So that's the long way of saying that's a lot of air pollution annually from one source, not to mention the 28 other sources, not to mention all the smaller sources of air pollution. So our question is, now what? What do we do on our way as we're working towards decarbonization, as we're working towards transitioning away from burning of fossil fuels? What are the things that we can do in the meantime? And that's where I'm excited that we have this incredible group of panelists and who are researchers and doctors who are going to tell us how they think about air pollution. They're going to share some of the work and the research that they're doing. And maybe we can explore some ways where we can help protect ourselves daily from air pollution. So with that, I'll turn it over to our moderator, Patty DeMarco, and thank you. Thank you all.
Thank you, Patrick. You're so kind. It's so wonderful to see all of you here this evening, and I'm not going to repeat any of the statistics that Patrick started with, but just to say that there are 131 million Americans who live within an experience of air pollution. And it has a number of serious effects on us, ranging from shortened lifespan to increases in cancer to respiratory and cardiovascular injuries. But, you know, I grew up in Pittsburgh. How many of you grew up here? Way back into the 50s, before the Clean Air Act. I can't tell you how wonderful it is to recognize, and we have to recognize this, that even though we still have air pollution problems, compared to the way it was when I grew up in Pittsburgh, when you had lights burning at noontime in the daytime because of the smoke, we have come a long way because of the Clean Air Act. We don't want to go back. So, number one, the regulation helped a lot. Number two, we have things that we still need to control from the emissions in the air. Mercury, cadmium, all kinds of stuff. And some of those things are more dangerous because you don't see them. Benzene, some of the things that come from plastic manufacturing. However, we are on the cusp of a clean energy future, of a clean materials future, and Pittsburgh can be right at the center of that new green, clean industry if we stick with it, if we make it happen. So it isn't true that you only make money when there's smoke coming out of the chimneys, which is what I was always told when I was growing up. And I'm really happy today to have wonderful colleagues with us who are going to share their expertise and their knowledge and give us some insight about how we go forward from where we are. We have Dr. Gabriel Cisneros from the he's a pediatrician at the UPMC Children's Community Pediatrics. He's the medical director of the UPMC Children's Express Care at Children's Hospital of Pittsburgh. And he's the co-chair of both the Advocacy Committee and the Climate and Environmental Health Committee of the Pennsylvania chapter of the American Academy of Pediatrics. He's a founding member of Clinicians for Climate Action, and his clinical interests include child health and policy advocacy. We also have Dr. Nesta Bortey-Sam. He is going to talk to us about the types of local air pollution and his research and scientific data about that. He is an assistant professor of environmental and occupational health at the School of Public Health at the University of Pittsburgh, and his research focuses on understanding many aspects of environmental toxicology. And on Zoom, we have Dr. Megan Tipre, who is going to talk about the intersection between cancer and sensitive populations. She specializes in malignant hematology and medical oncology as an instructor at the University of Pittsburgh Hillman Cancer Center. So welcome to all of our guests. And I'm going to ask Megan if she would go first and give us a 5-minute summary of her presentation and her research. So Megan, the floor is yours.
Well, good evening, everyone. Well, I'm Megan Tipre. I was in the description. I just very recently moved from University of Pittsburgh to Virginia Commonwealth University, and I'm an assistant professor now in the School of Public Health, as well as assistant director for the catchment area data analytics for the Massey Comprehensive Cancer Center at VCU. I'm an epidemiologist by training, and my research focuses on looking at environmental factors and its impact on cancer in general, but more specifically lung cancer. So today I'm going to talk about how cancer, how air pollution intersects with cancer, and how it affects sensitive population who are more vulnerable to exposure to air pollution, and how it impacts the cancer outcomes. If I can make my slide move. Okay, there you go. So I want to just highlight some of the cancers that have been linked with air pollution. And I'm talking more about ambient air pollution specifically, not so much about indoor air pollution, but they have very similar etiology. So ambient air pollution, is typically from traffic emissions, industrial emissions, and then wildfires. So those are some of the major sources of air pollution that we see, especially in the United States. So the cancers that have commonly been linked, and there's strong evidence, is lung cancer, particularly long-term exposure to fine particulate matter, nitrogen dioxide, and polyaromatic hydrocarbons have been linked with lung cancer. Then there is growing evidence that suggests that exposure to some of the air pollutants is linked with childhood cancers, particularly leukemia and brain tumors, and air pollutants that are commonly linked. It's the criteria air pollutants, as well as outdoor benzene, and then you have radon and radon exposures as well that can be found in some of the regions in the US. There is growing evidence. The evidence is really weak at the moment. Since we are getting more and more data from large databases, and there is more research using molecular epidemiology. There has been some studies recently published that have shown association between diesel exhaust and traffic air pollutants and bladder cancer, prostate cancer. A very recent paper from China linked air pollution to colorectal cancer, and air pollution has also been linked with breast cancer. So many of these areas still require a lot of investigations and more stronger, there's still, the evidence is not as strong enough to make a conclusion, but there is enough evidence to show some association. So when the slide earlier was talking about the risk, the increased risk of cancer due to exposure to air pollutants, long-term exposure to air pollutants. Air pollution also impacts someone who has been diagnosed with cancer. It can impact it can have some effects on cancer treatment and its outcomes, as well as cancer survivors. So for cancer treatment, it can, again, exposure to higher levels of air pollutant can have some effects, exacerbate the comorbidities, so particularly pulmonary or cardiopulmonary outcomes, comorbidities that people may have. Those can be exacerbated, which in turn can affect the cancer treatment and have effects on how an individual responds to cancer treatment. And it then can affect the efficacy of the cancer treatment. Among survivors, so cancer survivors, there is, again, some research that suggests that it increases the mortality. So if people who continue to live in the same area after being diagnosed with cancer and treated for cancer, it increases the mortality, risk of mortality for cancer survivors, as well as overall quality of life. And this particularly happens because air pollution is also linked with pulmonary outcomes, as well as it affects the cardiovascular system. So these are some of the causes of non-cancer, leading causes of non-cancer related deaths amongst cancer patients. So it can contribute, so air pollution can contribute to increased mortality in this way amongst cancer survivors. So who are the people who are most likely to be affected by, who are the most sensitive populations, vulnerable populations? Of course, all of us are exposed to air pollution, but it's very difficult really to tease out that association because one, it's very difficult to monitor individual level air pollution at individual level across a large population, but it also, it is different region to region. So the sensitive population or vulnerable populations are children who have developing lungs. They have higher respiration rates. They have longer lifetime exposures. So early childhood exposures can have they can cause childhood cancers. Let me rephrase. Can have association with contribute to childhood cancers, but also can have can affect cancer outcomes in adulthood. Similarly, elderly adults who may have existing comorbidities, cardiopulmonary morbidities, can have longer exposure periods. Their cumulative exposures over their lifetime is higher, weaken immune defenses, and again, higher prevalence of chronic diseases can increase their risk for, increase their susceptibility and increase their risk for cancer. Low-income and racially and ethnically minority populations are more likely to be exposed to ambient air pollution due to neighborhood built environment, as well as proximity to the sources of air pollution. Either it could be industrial emissions or being in proximity to highways and highly to vehicular emission traffic. And this is a result, oftentimes results of historical redlining and environmental injustice are predominantly in areas with racial and ethnic minority population. And the other group that are more vulnerable to air pollutions are due to occupational exposure. So construction workers who are more outdoors and are working with materials that can increase their air pollution exposure, transportation workers, as well as refinery workers might also be more at risk of developing cancers associated with air pollution. And what makes these populations more vulnerable are, as I mentioned, children, fetuses, prenatal exposure, children, elderly, immunocompromised populations are more susceptible due to children because of their developing lungs, more outdoor activity, more just higher breathing rates, and we just talked about that. The second factor that one has to consider is social determinants of health. I've already mentioned residential segregation. That, in addition to that, limited access to healthcare, underinsurance can exacerbate disparities. So some of the disparities that we see in cancer outcomes, particularly among racial and ethnic minority populations, is not just because they are exposed to higher levels of air pollutants, but also they may not get early screening and have and get diagnosed at late stages. They may not have enough adequate treatment opportunities or adequate treatment, as well as follow-ups and due to underinsurance. So that, again, increases their risk for cancer-related mortality. And again, environmental injustices. So these populations can have disproportionately exposed to industrial and traffic pollution, and may have limited political power to really take action against that. I want to give a couple of examples, given the short amount of time. So this is a recent paper from American Academy of Pediatrics, and it just shows the percentages of children who are living in areas, in counties, that for different types of pollutants, but you can see this last line, the black line, and it goes from 1999 to 2016. So you can see there's a decrease in that percentage of children living in areas with pollutant concentration above the current air quality standards. But you can also see there's a slight increase towards the end, but it's significantly high. It's 70 to 75%. So we can see children are sensitive populations, and quite a higher percentage are living in counties that are that do not meet the air quality requirements. And I wanted to give a more local example. So this is a study that I did. We were looking at identifying neighborhoods and people living in the neighborhoods with higher lung cancer burden linked with social and environmental drivers. We used cancer registry data on lung cancer to assess that association. And what we found was that increasing quintiles of neighborhood deprivation index, which is a complex index of income and access to care, education, and 13 other factors, 13 demographic factors. So the neighborhood deprivation index comprises of 13 demographic factors, and it was associated with increasing risk of lung cancer incidence and mortality in Allegheny County. So what it means is higher the neighborhood deprivation, higher was the incidence and mortality in our county in Allegheny. We also identified tracts that had higher deprivation and higher lung cancer mortality, and these were when we So on the right side, the map shows areas that are color-coded in dark blue, light blue and dark blue. And really, if we focus only on the dark blue, those are areas with higher deprivation and higher lung cancer mortality. And these are areas historically in Pittsburgh or with, and even current, with higher industrial pollution, and these are heavy industries, glass and coal, and so on. So if you overlay the dots represent sources of industrial pollution, essentially are, I think, the 10 major industries in Pittsburgh area, and you can see that they really align well right on top of those areas that are blue. This does not mean that everybody in this neighborhood is going to get lung cancer. This is just to show that there is some evidence to show that people who live in these areas are at higher risk for lung cancer and cancer-related mortality. These are some of the references. I will be sharing the slides. So you can always go back to some of these references that I've listed over here if you wanted some more information.
Thank you, Megan.
Stop sharing, and thank you for your time.
That was wonderful. Thank you so much. And we'll have questions after everyone has spoken. So
Yes,
I'm going
of
to
course.
ask now Dr. Nesta to please give his remarks, and you can go ahead.
Hello, everyone. My name is Nesta Bortey-Sam, and I'm an assistant professor of environmental occupational health at the University of Pittsburgh School of Public Health. I have been in Pittsburgh for about 5 years. I moved in from South Dakota. And when I interviewed, and before I came to Pitt, I had no idea of Pittsburgh, zero. I did not look up anything, which was good. I had an entirely different research objective. My research design was different. But when I moved to Pittsburgh, I started reading a bit about Allegheny County and a few other things. And then one thing was constantly recurring. That was air pollution. So then it occurred to me, well, this is where I'm at right now. The research I came with or had discussed is important, but this is where I live. Why not look into what is going on in Pittsburgh, Allegheny County, and see how that could shape life, how that could impact public health, how that could interact with all the things going on, and then promote public health. So fast forward a few years ago, Dr. Tinaindo is here. She's my collaborator on a few different projects. We designed a study looking at air pollution and asthma exacerbation using a cohort, a UPMC cohort. One of the other things about that study is we're looking at how do we educate the public about air pollution? What are some of the misconceptions? What are some of the things that we as academics assume that community members know? What are some of the misconceptions? What do they think of academics, right? There seems to be a gap between what we do. We stay in our own little corners and offices, and then we do our own things, and then we pass on that knowledge in terms of publishing, but how many understand what we publish? So we did that work in Homewood. It recently just ended. We found some interesting things. There were changes in terms of what we were looking for, positive changes, but again, this is what interests me, looking at how the places we live could impact and shape our health. There's another study I've been doing with ROCUS. You may be familiar with ROCUS, reducing outdoor concentration in indoor spaces. And we have been looking at their data over a 5-year period. And it's showing high concentrations of PM2.5, which is a criteria pollutant. Dr. Megan has just talked about it. But also importantly, we all have HVAC filters, or most of us have, or most of us may have air purifiers. Those HVAC filters, how often do we change them? Those HVAC filters, how long should they stay for? what are they trapping in our indoor spaces that we do not pay attention to. So these and a few other things are what we've been looking at, and I'm happy to share more with the group as we proceed in the course of this meeting. It's nice to meet you all.
Well, I'm sure we have lots of questions for you when we're finished with presentations. Okay, Dr. Cisneros, I think you have some slides now.
Yeah, I have just some pictures out to tell my story. I'm a clinician, I'm not a researcher, so I just thought I'd talk about my experience working as a pediatrician. So what we're looking at here is a picture starting my intern year. Here we go. This picture is taken in 2009. I'm an intern in my pediatric residency, so it's the very beginning of my training. And I'm with my colleague, Dr. Sean Vigil. This is at Community Regional Medical Center in Fresno, in Central California. I grew up near there, and I matched there for my training, and it was nice to go back to. It was a really hard place to work and train. And so what we're looking at here, we're in the NICU. We're on call, something called night float. So we basically would work evenings from, I think, like 5 p.m. till early morning, like 7 a.m. And we were the two pediatricians in charge of the entire hospital, basically. So we would admit children to the pediatric ward. We would care for these newborns in the NICU who were very vulnerable, born premature, and have a lot of health conditions. We would go to the neonatal resuscitations when the babies were born and help resuscitate them, and then do consults in the ICU and the burn unit. That show, The Pit, it was like my version of The Pit. And I say all that because we were practicing in a medically underserved community. So Fresno has the ignominious distinction of being the fifth largest city in California, and yet also has one of the worst air qualities in the United States. So I'll show another picture, if I can. So this is a picture of the skyline of Fresno, and what you're looking at are just a very polluted air over the downtown city. And so part of what we would do when we were on call and during the day is admit sick kids with asthma exacerbations. And we saw so many kids who were sick with asthma. It was just pretty overwhelming. And fortunately, we were able to care for them in a way that would get them better, give them steroids and breathing treatments, albuterol, and eventually they would be breathing normally again, sometimes days in the hospital, sometimes in intensive care units. So seeing that day after day, would leave an impression on me. And then when you discharge them home and you look outside and that's what the air looks like, you feel like it's almost not futile, but you want to get to the root cause of what's going on. And so I bring all this up. You may be asking why I talk about Fresno, and I share that because it turns out Allegheny County isn't all that better compared to Fresno in terms of air quality. So this is a table from the American Lung Association that shows statistics regarding the population of Allegheny County, as well as the number of children in Allegheny County. And I highlighted the two arrows point to the number of children who are diagnosed with asthma under age 18. And so you do some quick math, and it averages out to about 1 in 10 children in Allegheny County have a diagnosis of asthma. Now compare that nationally, it's about twice the national average. So it's to me an unacceptably high number. And I think part of what I hope to do in talking with you and doing the work that I do is to maybe make some progress in that. I think that there's real opportunities for improvement. And so this is another photo. This is taken, I think, October of 2023, flash forward in decades. And what we're looking at is a tent that's set up outside the emergency department at Children's Hospital in the fall 2 years ago. So when you think about what happens when you have a county where 1 in 10 children suffer asthma, and you combine that with a triple demic of flu, RSV, and COVID, and suddenly you have yourself an overwhelmed healthcare system where we're having to set up tents to accommodate all the sick kids. And so I have firsthand experience in this because I work at the Express Care on the 3rd floor of Children's Hospital. And we, every fall and winter, just get crushed with the number of sick kids, asthma exacerbations and flu, COVID, RSV. Many of these illnesses are preventable with vaccines, mind you. But if you have a baseline, a high level of children who are sick or with asthma or were born premature, several other illnesses, it creates an environment that is very difficult for us primary care pediatricians to work in. So this is a slide from the same study that Dr. Michelle was sharing earlier, basically outlining how poor air quality, air pollution impacts our health. And it's broken down by age. So as mentioned earlier, prenatal exposure, I think people don't recognize just how significant that is, how air pollution affects the growing fetus and downstream effects on the child's health later on. So that photo of us in the NICU, I never made the connection that so many of the children that we were seeing who were born low birth weight and premature, a lot of them, I think, are attributed to the unhealthy air quality in the region. And so no one ever made that connection, and only after years of experience and learning and doing research does that now come to mind. And I think it is worth understanding for everyone. And then so we've mentioned asthma. What's also, I don't know if you guys can read this from where you're sitting, but included in the effects of air pollution on child health is our central nervous system effects. So right now there's this great conversation about why are there so many children who are being diagnosed with autism and other developmental disabilities. I think it's an important conversation to have, and I think sometimes the wrong conclusions are drawn, and sometimes the things that we are starting to understand don't get attention. And so there's a growing body of research that shows that air pollution does increase the risk of autism when you look at exposure prenatally. And the theory that makes that connection has to do with how air pollution affects blood pressure in mothers while pregnant, and how that can lead to a lot of different problems. So in the interest of time, I'll keep advancing slides. I don't want this to be a total downer of a talk because I think, again, there's really opportunities here. So this is just a simple slogan, electrify everything. So Dr. Noe Woods is in the audience, and she and I and some other physicians have been involved in reducing the pollution associated with the healthcare industry. It's really important work. It's hard work, but there are a lot of great technological advancements now that allow us to reduce pollution from industry as well as transportation and energy. So to me, that's where the work lies. That's where our attention should be, and if we're going to make progress on this problem. And again, this slide I put to reiterate about what the problems are and what aren't the problems. So much attention on, so what kills children, unfortunately, in the United States, guns, and the #1 chronic disease of children in the United States is asthma. Also, dental caries is another one. But I just want to reiterate what's important and emphasize what's not harming people. So COVID vaccines aren't harming kids. And red dyes, I think there's a lot of concern there, and there's some interesting research about how that affects kids. But I think in terms of priority, I think the left side is where our priorities and attention should be. So with that, I thank you for your attention and welcome any questions.
Well, thank you. That's an amazing amount of information in a short time. And I wanted to give each of you a chance to answer a question that I think we're all sort of stimulated by what you said, and that is, what can we do to reduce our risk of air pollution? And if you would each take a crack at that question. Can Megan hear my question? Okay, could you find a way to transmit that to her? And we'll start with Dr. Nesta. What can we do to reduce our risk of health harms from air pollution? What can people do?
I think one of the key things is education, There is the US EPA Air Now. I don't know how many are familiar with it, but it's also available on the GASP website. If you know what you are looking for, then it's one of the ways you could avoid it. If you do not know, then of course you are walking in blank. If you know what the air quality is, for instance, if the AQI or the air quality index says bad, then you know you have to limit your time outdoors. If you know it says extremely bad, then you know you either stay indoors or reduce how much time you spend outside. Granted that sometimes we do not have all the choices or all the options, we still may have to go to work and do some things, but first and foremost, we need to be aware of the things. Without that knowledge, then you don't know what else you'll be doing. Same way, if you don't know you have to change your HVAC filter, then it's still there. It's not going to be doing what it's supposed to do, right? And then a few behavioral changes. At home, what do? There's a common concept which we all do. The first thing you do when you're having visitors around, or when it's Christmas, or when you have people come to your home, is to light up a candle, put in air freshness, make your home smell nice. All the household chemicals that we use, all of these are exposing us to different chemicals, different contaminants that are worsening our health. So there is a long list of things we can do. How often do we clean our homes, mold, how do we avoid them, and all of those things. But I think a key concept is education, because once you have that information, it goes a long way. It's very easy for us to say that you should all know because we know, and that is a big misconception. There's a study we are doing with UPMC now, recruiting 1,500 mothers and newborns. More than 90% of the mothers do not know about lead. Lead is a criteria air pollutant by the US EPA. Lead causes so many problems, behavioral, cognitive, blood problems, anemia, you name it. Eventually it could lead to mortality. But again, people do not know. And so as we create that awareness, as we educate, then people are aware that if I do X, it's not good, it might lead to bad effects. If I do Y, it might help. And a few other things, but I'll pass it along and then share more as we all get a chance to share our thought on this subject.
Shall I go next? So, yeah, I totally agree that the AQI is a super powerful tool to protect yourself and understanding like what the risks are on that particular day or the days ahead. I'll also just emphasize, focus on your own wellness, you know, reduce your own risk by improving your personal health, whether it be through healthier eating, more regular exercise, but more sleep at night, managing your own stress, you know, seek counseling if you are struggling emotionally, and to vaccinate yourself. I think whatever you can do to improve your own personal health and make yourself less vulnerable can reduce your risk if and when you get sick with like cold or flu. I'll also just say, like, if you suffer an illness like asthma, to see a doctor and help get your asthma under control. We are fortunate that we have some really great medicines now that can really help reduce your frequency and severity of asthma exacerbations with some really good medicines that have low side effects. So just another way. And then I'll give a shout out to air purifiers. So when the wildfires were burning, I myself have asthma and found myself coughing and needing albuterol more frequently. And in my bedroom, we ran an air purifier, and that really helped me sleep at night. So just another simple thing. Thanks.
Dr. Megan.
I think some of it, reduction of air pollution exposure can be at multiple levels. It can be at individual level, community, and of course at policy level. So some of the things that at the individual level one can do is we get alerts. We are very widely using smartphones, things like that. So seeing what the air pollution indicators are, weather alerts, and avoiding outdoor exposure for children or for even adults, elderly, to be outdoors at a certain time if it is red, orange, based on the air pollution. Some of the things that having air filters or air purification filters. Of course, a lot of these interventions can come at a cost. So one has to take into consideration, and it is difficult to reduce overall air pollution, personal exposures, unless they are done at the policy level and at the government level. So definitely, I'm not an expert to talk about policy and community action, but I think at the local level, talking to your local stated EPA administrators, or taking action at the community level might be some of the ways that we can take actions against higher levels of pollution. And being aware of the air quality around your neighborhood, around your city. There are now cheap monitors that are available that can be installed in your homes or around your homes, but they can give you some indication really about these things. They are not 100%. What an individual will have exposure, it matters, but and then some of the things that if you are in if your residences are in areas where there is higher levels of industrial pollution, then some of the things that can reduce exposures for children inside homes is maintaining clean environments, having some filters, HEPA kind of HEPA level filters routinely changed in homes that can reduce some of those exposures, and then taking, I think, working with the state and national level authorities, EPA, making a political influence that can change, make a change in your area. I think some of those can reduce air pollution exposure overall.
Thank you, Megan. Thank you so much. I wanted to ask Dr. Nesta if you could discuss a little bit about some of the indoor air problems that we do have control over, in particular radon. I know you've done some work on that, and I think that's something people are underaware about. So if you could expound on that a little bit.
So before I say anything, there's a radon kit at the back, and then also an info page. Please feel free to pick a copy before you head out. So radon is one of the air pollutants that we don't think a lot about. One being that we don't see it, we don't smell it. There is nothing indicative of radon. And also, it's as a result of no one's fault. It's a natural component of the earth crust. So if you're in a house, there may or may not be radon. It's entirely different. The radon levels at this very point may be entirely different than when you go to the garage. Right? It's purely geological, and it's as a result of breakdown of different chemicals. It may surprise you or may not surprise you that the 43% of homes in Allegheny County have radon levels over the US EPA limit of 4 picocuries per liter. And at 4 picocuries per liter, the EPA suggests or mentions that 7 in 1,000 people may have lung cancer if they inhale that 4 picocuries. Right, and so if 43% of homes have radon levels over that limit, you can do the math. It's a lot. And that is why there is radon testing before you buy a house. And that is also why it's important that if you find levels over that limit, you speak to people for mitigation. it's good to monitor radon, and it's good to keep an eye on it. 20% of all lung cancer cases are as a result of radon. 10% are among people who do not smoke or have never smoked before. But again, because we do not see it, we do not smell it, we cannot relate it to anything, we do not pay attention to it. There are strategies and lots of strategies to combat radon. There has been lots of policies that have changed. There's been lots of money invested into radon because of the potential health implications. Again, the information is there, but we may not know because we are not familiar with it. If I'm buying a home, I may pay attention to radon because I know something about it. I may pay attention to it because it's part of the requirement to look into it. But if they told me my radon level is 6 picocuries per liter, what does it mean to me, right? I don't know what that standard is. I don't know what that standard means. They may suggest that you seek remediation, which may be expensive. They may suggest that you continue to monitor, which, again, may be expensive or inexpensive, depending on what type of monitor you buy. But again, radon is one of the things that we don't pay attention to. There is a lot of talk about PM2.5, the criteria air pollutants, which is sulfur dioxide, lead, oxides of nitrogen, ozone. But radon is always under the radar because we do not pay much attention to it, and because it looks like other pollutants have taken, are more popular than radon. Let me put it that way. So then it's always something we put under the rug. We forget about it, but it's equally very, very important. And if you get a chance, read more about radon. It's not good. It's a natural component, so no one causes it to be high. Typically in basements, levels are high. Basement and then first floors, as you go up, the levels reduce. Sad to tell you, but we have all been exposed to radon. We are all exposed to radon. What those levels mean depends on how much of it we are exposed to over a certain duration of time. Thank you.
Yeah, and Dr. Gabriel, if you would tell us a little bit, you've been talking about pediatric experiences with the air pollution. What are the early signs that a child may be extra sensitive to air pollution harms? How can you tell if your child is susceptible?
How can you tell they're susceptible? I think there are many ways of telling how they might be sick respiratory-wise. Obviously, like coughing and wheezing, and maybe like with their activity, you might notice they're limited. I think maybe what you're getting at is like, how do you tell if there's something that there maybe put them at risk? Certainly, if they're born premature, that's a risk factor, and their lungs haven't completely developed, and their risk might be higher depending on just how early they were born. And similarly, like how much they were weighing at birth, like they were lower birth weight, that might be another risk factor. I guess I think about it in terms of like, what are, there's that phrase, like the body keeps the score, and so like, what are all the factors that affect a child's health? And so when you consider like their gestation, the environment that they live in, what this maybe like the stress that they might encounter growing up. We were learning more about what are called adverse childhood experiences. So how the number of bad things that happen to a child when they're young is cumulative and puts them at greater and greater risk for all sorts of things like cardiovascular disease and risk for mental health problems and substance abuse and shorter life expectancy. Yeah, I think when we're seeing patients in the clinic and we're kind of trying to tease out those things, asking about the home environment, family history, social history, and to better understand that child's health and wellness and risks, and try to have a positive impact. What can we do to manage those risks? How can we help them meet their goals and live their most full lives? Yeah, it's hard work. We don't have a lot of time to do those kinds of things sometimes, and sometimes we we can't get to all the things that we want to. It's hard work, but it's rewarding, and I love it, and it's important work. So I think whatever we can do as a community, kind of think long and hard about the world that our kids are growing up in and how we can make it better for them. I think that's something that we can all do, you know. Yeah.
That's a really good point. I mean, it takes a village, right? Yeah. I know they have questions in our audience, and I would like to invite anyone who has a question to please raise your hand, and we will see if we can get all of this wealth of expertise. Please.
So I just wanted to see their comments or anybody else that knows of resources and ways that people get involved in the community to do more.
Right. You have any suggestions for resources?
So, as part of the, I'll speak loud. As part of the work we have done in Pittsburgh, we developed a beginner's guide for outdoor air pollution. We have provided this document to GASP. What it does is breaks down the AQI values from the US EPA. For instance, if it's purple and it says limit your time outdoors, that is relative, right? What is limit my time outdoors? Should I be outside for an hour? Should it be 2? Should it be 4? Should it be 5? So this is readily available. You can download a copy of it, or maybe the team could share that with you. But additionally, there is ROCUS, and I don't know if you are familiar with it. They provide free testing for particles, carbon monoxide, carbon dioxide, and radon for a month without any charge to you. At the end of that study, they can come or send someone to your home to check how your HVAC system is working. ROCUS is reducing outdoor concentration in indoor spaces. If you reach out to them, they do the testing, I think, 3-4 times in a year. So it's quite frequent. And within that 1 month, you volunteer, they ask you to complete some surveys or questions. That is more toward understanding what the source of indoor pollution is in your home. You also put a monitor outdoor. That way, they're able to tell you or predict that, well, around this time, your outdoor pollution was high. That could be coming in through the spaces. Or radon was high at this point. Or when you cooked and you opened your windows, there was dilution, so the levels were low. Or studies have shown and reported severally that electric cookers produce less contaminants than gas cookers. Again, you work with them, they tailor what you have and then provide recommendations based on what they have seen or what your data has shown. But they do monitor indoor, outdoor air, they do monitor carbon dioxide, carbon monoxide, radon, and then test your HVAC system and make recommendations as
Thank you. That is reducing outdoor contaminants in indoor spaces, ROCIS.org.
What about N95 masks? And I understand there are even N99 masks now. Are they going to help with the pollutant levels at the 2.5?
Studies have shown that the N95s and the KN95s are helpful in reducing air pollutants, but the surgical masks do not.
Right.
So again, if you find yourself in a situation where it's very bad outside in terms of the air quality index, you may put on an N95 just to limit the exposures to protect your health. And then talking about sensitive population, children, adults, pregnant women, people who live in EJ. So if you notice these, or you're outside and you have a heart or a health condition which is chronic or may make things worse, then you protect yourself.
And as I said, they actually have N99 masks now for even more protection.
That's great.
I'm sure Mark has one back there. The fellow at the video camera has a super duper mask.
It's called a P100 mask. It's better than an N99. And it also doesn't, don't have to throw it out after using it. You can reuse it.
Great.
Thank
So
you.
yeah, lots of resources are being made available, right? Because sometimes, to my previous point, you may be working and don't have the chance to leave, or the distance between where you are to home is quite far. Then if you have these available, you put them on to protect yourself and limit those exposures, which might worsen a heart condition or a respiratory outcome or your general health overall.
Other questions? Yeah, right here.
We're talking about homes, but I'm thinking, does Allegheny Health Network and UPMC reach out to the schools? I'm a grandparent of 2 kids at Montessori. They'll be going to another school. There's going to be construction. And I don't even know what's in these old school buildings. And the kids are in school longer than they are at home. So you're talking about at home, but I don't know if you're reaching out to teachers, schools. I'm thinking about kids at recess at the wrong time and then getting in trouble because they're tired. I mean, I could go on, but you know where I'm going. I mean, are you reaching out to Pittsburgh schools, or have they reached out to you with this crazy reorganization?
I think that's a really great point. I don't think we do enough to talk about and address that. You're right, they spend most of their day there during the school year, and there are exposures there for sure. Yeah, we should be doing more. I don't think that we are.
I'm not blaming. I'm just thinking as a grandparent.
Yeah. And that's very important. You may or may not have heard about the pole hall incident in North Carolina State. The pole hall incident in North Carolina State. So lots of people have been diagnosed with cancer just because of where they worked. They spent time at a place. It happened that the building contained a chemical called polychlorinated biphenyl, a PCB. So because of that extended stay within that building, as of last year, more than 250 of them were diagnosed with cancers. And these are just cancers. How about cardiovascular health? How about respiratory? So the places we spend time have a way of impacting our health. I know Dr. Indo, sitting in the back, is working with other colleagues at the School of Public Health, looking at classrooms and air pollution within those spaces. So.
Now, this is something that parents can do, though. When you're going to your child's school, you can ask them about their air quality policy and conditions that your child is experiencing at school. You can be a pain in the neck about it. I know when I had children in school, my son had asthma, and I was always complaining about the conditions under which they had sports or recess, and it was an ongoing gun battle to no avail, but at least we can raise the issue. Yeah.
Can I add something quickly?
Yeah.
Rita mentioned Women for Healthy Environment. They just published a school report. It's for the state of Pennsylvania. They surveyed every school district. They got really incredible info from, I think, 265. And there's really great data on, the survey was on if they test, and they were asked to test for lead, for radon, for lots of different environmental carcinogens. And they also know the results of the testing and which school districts have decided to mitigate and which have not. So if you Google Women for Healthy Environment School Survey, that should be enough to bring it up, but we can also include it in an email after.
Good. Thank you for that. Other questions? Yes.
Yeah, Dr. Tipre mentioned neighborhood deprivation.
Dr. Tipre?
Neighborhood deprivation index is an index of it's a compilation of different demographic factors. As I mentioned, you have the income, the proportion of people with certain income level, different types of income levels, the proportion of people who have whether they have insurance, do not have insurance, education levels, and it's basically a composite index that gives you some indication about the neighborhood's overall economic index, and it's been widely used, particularly the one that I showed. It has been approved. It has been used by the National Cancer Institute, and since we do not have individual level data, it becomes a surrogate typically at the census tract level, because we have a lot of census data available, right? So we at the census tract level, census block level about a lot of demographic information. So the neighborhood deprivation index is a composite index of several demographic factors put together, and it ranges from 1 to 100, but it's like a below anything that is on the higher side, it's more deprived. Less deprived is between 1 to say 60, and it's a range. So typically, the most deprived neighborhoods may have a range between anything about 80 to 100 would be considered more deprived or most deprived, and then you have more deprived and less. It depends on how you want to use that index. It can be a continuous variable. Typically, it is you have you divide it into categories, either quintiles or quartiles, and usually the index is done for the entire state, and you use that as a reference point for your local area. So I hope I answered the question, but I'm happy to even share the link. When I share the slides, I can add the link to the neighborhood deprivation index, more information about that.
Thank you. Thank you very much. There is also, Allegheny County does a community needs assessment database, and that has a great deal of that kind of information in it as well. It's publicly available on the Allegheny County website. Yeah, other questions? Yes, in the back.
So my question is there a good reference that shows how far noxious fumes and particulate matter can be carried in the environment?
Okay, do you want to speak to that, Dr. Gabriel? Who would like to speak to that?
What I can say, when I was in Fresno, I mean, a lot of the air pollution was coming from the Bay Area, very far away, and that, so it travels. I know that there was the Pennsylvania Health and Environment study that came out 2 years ago about the impact of fracking on health, that showed how proximity to these fracking sites is associated with poor health outcomes like worsening asthma, increased risk of like cancers like lymphoma, and lower birth weight in babies. That association was related to how close they were to those sites. So, and I think the distances were like in terms of miles. So it was almost as though like nowhere in southwestern PA was there a safe place because there's so many fracking sites in the region. So I think it feels like nowhere's safe sometimes.
There is a great deal of study that says from 1 to 3 miles of a petrochemical facility, you are in a heightened level of exposure. It's over 39 million Americans are within that radius of a petrochemical facility, and the data are very compelling. Physicians for Social Responsibility have a great deal of documentation. Maren, if you could speak to this a moment.
A little second-handedly, my spouse is an air quality scientist at Carnegie Mellon. And 25 years ago, they had a big study, if people remember the supersite trailer that was in Shenley Park. And the comment that they made was that about half of our pollution here comes in from upwind. Although when you're dealing with fossil operations, a lot of that is volatile. So a lot of stuff happens in the atmosphere. Particles form and disintegrate and change what they're made of. So definitely, since a lot of volatile stuff is associated with fracking, there you're going to have a very close distance relationship within a mile, within 3 miles, within 10 miles. And how close you are also depends on the prevailing winds. So the town, small, lovely town of Beaver in Beaver County is in a bad situation because not only is it close to the Shell ethane cracker petrochemical facility, it is in the predominantly downwind zone. We are occasionally downwind from there, but not that often. What was planned to be the second petrochemical facility just over on the other side of the Panhandle in eastern Ohio would have been more 50 miles away, but it would have been more in the prevailing wind. There's a thing you can look up called the wind rose that shows a graphical representation of where the wind is usually. There are times when there's an event, like a fire or explosion at Clairton Coke Works, and it may happen, as I think it did. I was out of the country at the time, but sometimes it happens that the wind isn't in the usual direction when a thing happens, so you can't count on the prevailing winds to govern your exposure completely. But there certainly is stuff like particles, PM 2.5, a lot of that, like half as of 20 years ago, is coming in from Ohio, and their TEP, or whatever it's called, is even worse than ours.
Thank you for that. Another comment over here. I think we have one more after that.
I want to see if you have a comment or more or two about two things that are very different. One is how climate change is impacting pollution. We know because 2 years ago we had tons of more pollution in the summer from the wildfires in Canada, which is very obvious. And then secondly, and you don't have to answer that one, you don't have to answer this one, just a thought. COVID impacted people's lungs. So when your lungs are now more compromised, and even though I've only had COVID twice, I feel like my lungs have been compromised since I didn't even have it. So the impact of that on and air pollution together, are we seeing any changes?
Yeah, I'm going to repeat the question. She was asking whether the combination of climate impact and residual effects from COVID might be evident in our current health conditions for air pollution.
Certainly, there is a relationship between those two. A few studies have been published showing that for people who lived in areas with high air pollution, they suffered the effect of COVID even more. And the reason behind it is, as you're exposed to air pollutants, the cilia, which is meant to be protective of the respiratory system, is damaged or not function at full capacity. So when that happens, when there is an infection, anything that is meant to be protective is not working full capacity. So it leaves us vulnerable. So that has been the logic or the science behind it. And that also shows a lot why places where air pollution is worse are the places where COVID hit the most, or places where they suffer the effect the most with mortality and high risks of COVID and so on and so forth. Studies have shown that if the air pollution increases by 1 microgram per meter cube, in this case PM 2.5, COVID-19 infections or mortality increased by certain percentage. Right? And again, it's because of all the damage that has been done to the respiratory system that leaves us vulnerable. And to your first question about climate change and air pollution, there is a strong link. Canadian wildfires. Again, we get lots of pollution from Canada and then from Ohio. Right? We're in an environment where chemicals are transboundary. And by transboundary, I mean it's no respecter of place or where they are released. It could be released here, but could go very, very far and then settle somewhere. At some point, most people or some of us were concerned during the Ohio train derailment. There were questions around, should I be concerned? Are the chemicals coming in? All of those things. So again, California wildfires, they have strong impact on everything else. The chemicals that are released into the atmosphere, carbon monoxide, carbon dioxide, so many. And then, in effect, what is the implication on air pollution and health of residents? So both have shown strong links or strong connections between climate and air pollution, and then COVID-19 and the impact of air pollution.
Okay. I think...
Can I just make one quick comment?
Yeah.
Which is that we're also seeing how climate change is prolonging the allergy seasons. So higher levels of pollen and affecting people who suffer allergies and asthma, and how that's impacting their health is something that we see every day. So that's important to recognize.
Thank you so much. I know we probably will have time if you want to speak after informally, but I think what we can see clearly is that we're all connected to the air we breathe. It's one of our life support systems to have fresh air, and protecting fresh air, clean water, fertile ground, and the biodiversity of species of which humans are but one part. That's what keeps us alive. And we need to defend our clean air every way we can, because what happens here moves. When something blows up in Clairton, we may not see it right now because of the air plume, but it's going to fall down somewhere close. And we're all connected. So I think it's a big responsibility that we have as people who are aware and active in maintaining the quality of the air that we breathe, that we speak out to our local health department, to our state DEP, and absolutely to the federal level. They're having hearings right now open on the endangerment finding of 2009, which established that climate change gases are toxic hazards endangered in terms of public health and the environment. Comments are open until the 22nd of September. There are 20 million places where you can find ways to make comments on the endangerment finding. Please weigh in. If it's informal to your congressman, or if you want to sit down and write a technical document yourself, there are templates for doing that as well. I just urge you to make your voices known, because this is something, as you can see, the regulations have had an effect. We have a long way to go. We're not done, and we keep putting things into the air anyway. But without those regulations, you would have Pittsburgh in the 50s all over again. So I thank you so much. I'd like to have a round of applause for our speakers. Thank you so much to our organizations that supported us, Cancer Bridges and GASP and the Environmental Health Network. Have a lovely evening. Thank you.